Now guys, there is a list again that which one associates with the URTI, which one associates with LRTI. So let's have certain things that which organism associates with causing up URTI and which organism associates with causing up LRTI. Okay, so that will solve your like most of the questions now. So obviously in the URTI what comes? The common cold, that is the rhinitis, done by the main one, that is the rhinovirus. Your favorite coronavirus is here also, and these were not the SARS coronavirus 2 one, they are the previous coronas also used to do all these particular ones. Okay, then it is manipulated by China and now it is termed as what? SARS coronavirus 2. Okay, then you have adenovirus, influenza virus, para-influenza virus, human metapneumovirus, respiratory syncytial virus or syncytial virus. Okay, so basically in this particular list, these are members of these particular Myxovidae family, which have orthomyxo as well as paramyxo ones. Mainly they are belonging to that particular family. Along with that, adeno is a like general fellow which does infection to all. Corona, yes, a very like lot of viruses are there in this group which cause disease, and rhinovirus is the main which does what? Rhinitis. Okay. Regarding the pharyngitis, if somebody asks you regarding the pharyngitis or sore throat, and you know that what is there in the pharyngitis? Inflamed, red, swollen, and it shows exudates, and sometimes the membrane can also be produced. Okay. So what are the various viruses involved in that? The viruses, again the same one, that is the influenza virus, para-influenza virus, which is a paramyxovidae family member, Coxsackie one, Coxsackie virus A, which does herp angina. Okay, remember this associates with picornavidae family. Okay, rhinoviruses, picornavidae family, coronaviruses here also they are Epstein-Barr virus and adenovirus. They all associates with what? Pharyngitis, and in them what can also produce? This particular membranes. Okay, so this is regarding the virus stuff which is there. Fine, I'm talking about the virus stuff before, like and after that we'll talk about some other causes of the same thing. Okay, and if you want to go like that, then we can go for that also. Okay, and the same regarding that, this list is continued from above, that which all are doing the pharyngitis and all. So obviously the most important one is bacteria, Streptococcus pyogenes. Then you have the Streptococcus group C and G, Arcanobacterium less known, Mycoplasma pneumoniae, Vincent angina, they all associates with this particular pharyngitis. Along with them is this Treponema vincenti, Leptotrichia buccalis, and even the fungus, that is the Candida albicans. They all associate with what? Pharyngitis. Okay. Now talking about the laryngitis. Laryngitis symptoms are hoarseness of voice, lowering and deepening of the voice. That is the laryngitis, and the most viral agents in which does it is same. The list is same only. Okay. So basically you should know that what comes in the URTI stuff, laryngitis and all. So again the same list is there. I will not repeat up. Okay. So this is regarding the laryngitis stuff. And then you have this another important question which is also termed as Croup, and acute laryngotracheal bronchitis happens to be in the children less than 3 years of age. Symptoms is having this stridor. And which type of stridor? Inspiratory stridor, which is a high pitched breath sound resulting from a turbulent airflow, that you know. Okay, that particular stridor sound. The hoarseness, fever, cough, they are present in this Croup. And the most important, you know, parainfluenza. Parainfluenza, which is Paramyxovidae family member 1 and 2. Parainfluenza 1 and 2, they does this Croup. Okay, so we are dealing with the Croup, and the most common cause of it is parainfluenza virus. Along with the influenza virus, RSV and adeno is everywhere, like cosmopolitan. So here also it is. So they are causing up what, guys? They are causing up this particular Croup. So we are like tackling up what? We are tackling up the URTI stuff. Fine. Now guys, this time in this URTI stuff, there was a question regarding the epiglottis or epiglottitis. Okay. Epiglottitis, there was a question. Fine. Epiglottitis. And this particular epiglottitis, you know, is what, guys? Edema and inflammation of the epiglottis and the soft tissue above the vocal cords. Okay, that's why it is in the URTI stuff. The children, it affects 2 to 6 years, and the features you see, the fever, difficulty in swallowing, inspiratory stridor, they are present in this also, like the Croup. most common agent used to be Haemophilus influenzae type B. Okay, what they have done there, that they have given an option of Streptococcus pneumoniae. Okay, what they have done,